going on, world? Welcome. Hey, you already know what we're doing today. We're doing NCLEX questions. We are doing NCLEX questions. Look, y'all, I'm tired. How many of y'all to come up in here so we can do this thing? We do the thing, all right? Welcome. Hey, if you guys just now start rolling in, my name is Kevin. I go by the Boot Nurse on all social media platforms. I want to make sure that everybody is here. Y'all know what we're doing. Make sure you guys smash that like button, you guys share, and you guys follow. We're going to be doing NCLEX questions today. As you guys start to trickle in, I want to know who you are, where you're from, and where you are at in your nursing journey. Hey, make sure, I need 1,000 likes. And I need 100 followers or 100 people up in here, or we're not going nowhere. Nurse CC is in the building, y'all. Dosage. Hey, what's up, Nurse C? Hey, anybody that needs dosage calculations in their life, that young lady right there will get you right. That is the dosage calculations queen and her kingdom. Look what I'm saying. Hey, dimensional analysis is where it's at. If anybody ever needs help, y'all go holler at her. She'll get y'all right. All right. Hey, so y'all need to smash that like button. Y'all need to share. Y'all need to follow. I need 1,000 likes. I need 1,000 likes. I need 100 people up in here. What are we doing? But of course, hey, I've been a nurse for almost 4 years. I've worked ICU, OR, and PACU. I was in the Navy for 16 years. All right. And I'm coming over here. We're doing some NCLEX questions. You know what I'm saying? It says, I'm really nervous about nursing school. Look. Nurse CC, if you nervous about nursing school, let me tell you, you should really holler at a blessed RN. She'll get you right. Somebody said, spam. Your name is Spam, like Spam Masubi? He said, Spam wants to, what's up, Spam? How are you? It says you love your, I appreciate you coming by. I appreciate you coming by to all the lives. I appreciate you being here. So, hey, I need 1,000 likes. I need 100 people up here. I need carpal tunnel right now. Make it happen. No, my name is Ashley. Shout out to you, Ashley. Welcome to the live. What's up, city girl? Yeah, I remember you. All right. Hey, but I want to know who you are, where you're from, where you're at in your nursing journey. Okay. And if you're not a nurse, what are you doing here rocking with us? Hey, as soon as I get 1,000 likes, and I get 100 people up in here, then I'll turn this thing around. I'll give you these questions, you know what I'm saying? But go ahead and give me what I need so we can go. Maritza, what's up? How are you? Mahar, I'm sorry, I do my exam today. Shout out to you, Mahar. It says, I don't know when results come. So I think you said you were in California, so it usually takes about 48 hours for you to get your results. Do you believe that the world is flat? What does that have to do with nursing? And no. People that believe that the world is flat should go back to school and understand what science really means. So there's that. Hopefully you enjoyed that entertaining answer that I just gave you that had nothing to do with nursing. Okay. So what's up? So, hey, what are we doing? I want to know who y'all are, where you're from, where you're at in your nursing journey. Hey, don't be shy. This is a safe spot. All right. Shut off at 85 questions. What do you think? I don't know. We'll see. All right. Hey, if it shut off at 85 questions, either you did exemptional, you got a 95% interval, and it's telling us that, hey, you did really well, or you did not so good, and now we'll take it in stride. It says last semester in nursing school, South Carolina. Shout out to you, Tiff. Last final tomorrow. Shout out to you, Kyrie. Shout out to you. Hey, we're almost there. We're at almost 700 likes. What are we doing? Just graduated this week on my BSN. Mads, congratulations. Now on to getting that license, unless you already have it. It says, hi, can recommend LP in the online program, please. There's a lot of them that are out there. I can't really give you specific ones. There's a bunch of them that are out there. They have a lot of bridge programs out there. WGU is a good one. NCLEX in 2 weeks. Kelsey in Ohio. Shout out to you, Kelsey. Hey, if you guys are just now joining, we're doing NCLEX questions. I need 1,000 likes. I need 1,000 likes. Hey, once I get 1,000 likes, then y'all will get questions. So happy Wednesday to everybody. Hopefully everybody had a really good week. I had a couple people come in here yesterday and tell me that they passed NCLEX, so I'm super proud of them. I graduate my BSN this comes Saturday. Shout out to you, Crystal. Shout out to you. 4 weeks till I graduate RN with BSN. Love to see it, Dodger. Congratulations to all of you. Congratulations. Hey, we're in that season. 'Tis the season for NCLEX, all right? 'Tis the season for NCLEX. But ladies and gentlemen, welcome. About to get these questions. Hey, I need for y'all to keep smashing that like button, and I need for y'all to keep sharing. I'm telling you, it gets out to the For You page. It gets out to the people that need it. All right. Don't be selfish out here. All right, here we go. Question number 1. Nurse John is caring for a male client receiving lidocaine IV. Which factor is the most relevant to the administration of this medication? Is it decreased arterial oxygen saturation when measured with a pulse oximeter? Is it increase in systolic blood pressure, presence of PVCs on a cardiac monitor? Or is it increase in intracranial pressure? What are we thinking? Aaron, what's up? Hello. Over here screaming at me like Adele. Hello, it's me. What's up? What's up? Hey, if you guys are just now joining, welcome. We are doing NCLEX questions. I got these questions off nurseslabs.com. They're free sets of questions. Make sure you guys go over there and check those out for yourself. Okay, make sure you guys go check those out for yourself. And also, if you are new here, I want to know who you are, where you're from, and where you are at in your nursing journey. Where you are at in your nursing journey. All right. Everybody's telling me C. Can you zoom out a little bit? Let's see if that works. Just a smidge. All right, just graduated. Shout out to you, Aaron. Congratulations on graduation. Congratulations. And my Post Malone. All right, let's see what our answer is in 3, 2, and the answer is C, is the presence of PVCs on the cardiac monitor. Lidocaine drips are commonly used to treat clients whose arrhythmias haven't been controlled with oral medications and who are having PVCs that are visible on the cardiac monitor. That is part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam. All right. Hold on. I would like to see nurse. Hold on. Donnie, what are we even talking about, bro? I don't even know. It don't even matter. I just passed my AAMA. Shout out to you, Jennifer. Alabama RN. Love to see it. Love to see it. All right. Hey, pharmacological and parenteral therapies, which is our second largest section on NCLEX, at 13 to 19%. LPNs is still the second largest section for you guys, all right? But the numbers are kind of a little bit different, all right? But it's still the second largest section, so you have to make sure you learn the same content that a RN learns, okay? You learn the same content that a RN learns. All right, here we go. Question number 2. Nurse Ron is caring for a male client taking an anticoagulant. The nurse should treat or teach the client to what? Report incidences of diarrhea, avoid foods high in vitamin K, use a straight razor when shaving, or take aspirin for pain relief. What are we thinking? What are we thinking? Hey, shout out to all 160 plus of y'all. We are doing NCLEX questions. I appreciate everybody being here, hanging out. All right. Make sure you guys share, and follow the stream. All right. Make sure you guys like, share, and follow. Hey, I need like 100 shares. It's the trifecta that gets out to TikTok. It gets to the For You page. All right. Get it out to everybody. Don't be selfish. Hey, we're on the road to 10,000 likes. If I don't have 10,000 likes and if I don't have 100 shares, I don't care who you share it to. Just share it to somebody, preferably somebody who would need it. All right, but if I get to 10, by the time I get to question 10, if I don't got those things, then I guess y'all are only getting 10 questions. So there we go. All right, what are we thinking? Everybody's screaming B at me. Everybody is screaming B. Well, let us see. Let us see what the answer is in 3, 2, and indeed the answer is B. All right. A client should avoid consuming large amounts of vitamin K because vitamin K can interfere with anticoagulation. All right. That's pharmacological and parenteral therapy. Second largest section on the NCLEX exam at 13 to 19%. So shout out to y'all. Hey, remember, pharm is second largest section. You have to know your pharmacology. You have to know your pharmacology. All right. Hey, so what is the anticoagulant that we're talking about when it talks about vitamin K? What are we talking about? Which one? Warfarin. There we go. What's another name for warfarin? Because you could see both. There you go. Coumadin. There you go. Shout out to y'all. Y'all smart out here. All right, here we go. Question number 3. Nurse Lynette is preparing a site for the insertion of an IV catheter. The nurse should treat excess hair at the site by what? Leaving the hair intact, shaving the area, clipping the area, or clipping the hair in the area, or removing the hair with a depilatory. Coumadin K, exactly. Remember Coumadin K, right? Heparin protamine sulfate. Remember the P in heparin for protamine sulfate. That's the antidote, right? So what are we thinking? We got C, B, A's. I don't think I passed. What do you mean you don't think you passed? Hey, so there's nothing that you could do about it right now if you've taken your NCLEX, right? So the only thing you could do right now is just wait. All right. But here's the one thing. If you are ever unsuccessful at the NCLEX, you have to take that in stride. You're going to get data to tell you where you didn't do well on. So that way you can improve upon those areas. That's the whole point. All right. That's the whole point. Do not be discouraged if you did not pass your NCLEX. It's okay. It's a part of your process. Remember that it's a part of your process, no one else's. All right. But here we go. Let's see what the answer is in 3, 2, and the answer is C, clipping the hair in the area. Hair can be a source of infection and should be removed by clipping. That's part of reduction of risk potential, which is the fourth largest section on the NCLEX. The fourth largest section on the NCLEX at 9 to 15%. All right, 9 to 15%. If this is an area that you don't understand, I would circle back and I would go and I would look at these areas. Hey, these questions are from nurseslabs.com. The rationales are not the greatest. I personally like Archer and other people like UWorld. Both are really good, have really good questions, have really good rationales. So if anybody's ever going to ask, I'll tell you either one of those. If you ask me both, I'm going to tell you either one of those. You can't go wrong. It just depends on you. All right. Here we go. Question number 4. Nurse Manasa is caring for an elderly female with osteoporosis. When teaching the client, the nurse should include information about what major complication. All right. Bone fracture, less estrogen, negative calcium balance, or Dewager's hump. Dewager's hump. I was like, who is Dewager and why are they humping? All right. But shout out to y'all. Hey, if you guys are just now joining, we are doing NCLEX questions. I got them off nurseslabs.com. Free sets of questions. Make sure you guys go over there and check those out for yourself. My name's Kevin. I've been a registered nurse for almost 4 years. BSN, if that really matters to you. I worked ICU, OR, and PACU. I've never used boot camp Bria, so I can't tell you. It's hump day. Yeah, Dewager's hump for hump day. No, let me stop. Oh, but shout out to y'all. I want to know who y'all are, where you're from, and where you are in your nursing journey. And if you're not a nurse, what are you doing here hanging? Thoughts on Kaplan? I like Kaplan. I like Kaplan. I actually used Kaplan, and Kaplan was what helped me pass. But remember, a lot of these reviews work. These reviews out here work. All right. But it may not work for you. Nurse student, shout out to you. I'm in fundamentals, shout out to you. Massachusetts, I graduated 4 years ago and never took the NCLEX. ULI. Oh, I'm sorry. Let me stop. Mari. Is it Mari? Ma'am, you got to take it. You got to take it. Thoughts on Archer? Archer's cool. UWorld, cool. It's expensive. I failed the first exam. That's okay. What are you going to do to go back and take it again? Mari, thank you for the TikTok. I appreciate you. But bone fractures is a major complication of osteoporosis that results when a loss of calcium and phosphate increases the fragility of bones. That's health promotion and maintenance, which is 6 to 12% on the NCLEX exam. 6 to 12% on the NCLEX exam. Yeah, Catherine, you got it right. Shout out to DMP. Wait, Mari, are you asking about a DMP? I'm going to actually do a Q&A after this. So after we do these questions, 25 years at LPN, Happy Nurses Week. Is it Quatina? Happy Nurses Week. Tay, what's the deal? What is the deal? Flight nurse medic here. Love the knowledge. Hey, Shay, I like you being here. I appreciate you. Here we go. Question number 5. Nurse Lynn is teaching a group of women to perform BSE, which is a breast self-examination. All right. The nurse should explain that the purpose of performing this examination is to discover what? Is it cancerous lumps, areas of thickness or fullness, changes from previous examinations, or fibrocystic masses? What are we thinking? I'm a senior nursing student, ready to be done. Tara, I know that's right. Hey, shout out to all 251 of y'all. We're doing NCLEX questions. Hey, we're on the road to 10,000 likes. If I don't have 10,000 likes by the time we get to question 10, I guess y'all are only getting 10 questions today. So that's completely up to y'all. Make sure you guys share. I need at least 100. You know what I'm saying? We can't be greedy out here. Y'all getting all this knowledge. Ali says, I love this. Ali, I love you. I appreciate you being here. Any suggestions on which test prep is best for somebody who graduated but never tested? You should go check out my course. It's the 7-day NCLEX course, and it's linked in my bio. And right now it's going for 70% off, $97, and you get it for a lifetime. So you can go check that out. All right. And we'll talk more about that. But the answer is C. The answer is C, changes from previous examinations. All right. Women are instructed to examine themselves to discover changes that have occurred in the breast. So if they did an exam and then 2 months later, hey, that wasn't there, that's something that needs to be brought up. All right. Because that's telling you that something is growing at a rapid rate. All right. Health promotions and maintenance, 6 to 12% on the NCLEX exam. How do you pass them ATI exams? Mari, I wish I could tell you. I do not know. I didn't use ATI when I was in school, but one thing I will tell you, all those ATI books, whoever Anything ATI related, use ATI material. If you're doing HESI, use Saunders and Elsevier. That's what you want to use, all right? That is what you want to use. But ladies and gentlemen, real quick, hey, y'all are on the road to taking the NCLEX. Graduation, then NCLEX. Graduation, then license. LPN and RN. Hey, I got some test-taking tips over there to help you conquer the NCLEX. This actually used to be one of my ebooks. This is 42 pages. Go over there. Go get it. It's free. All of y'all are cheap. I'm just saying, just like me, but go over there and get that for free. All right. It's thebootnurse.com/test, or you guys can find the link tree in my bio and it'll take you over there as well. All right. Sorry. What book you recommend for NCLEX? Was in your link tree? Yes. So my link tree has all that stuff. Laugh out loud. I'm cheap for real. Trust and believe me. We all cheap until it comes to investing in ourselves. And then we want to be cheap. When you invest in yourself, never be cheap. All right. You can be cheap when you go buy clothes and shit. But when it comes to your personal growth, never be cheap on that ever. That's y'all following me. Y'all gonna learn how to have a different mindset when it comes to your personal growth. I'm just letting y'all know. All right, here we go. Question number 6. When caring for a female who is being treated for hyperthyroidism, it is important to what? Provide extra blankets and clothing to keep the client warm. Monitor the client for signs of restlessness, sweating, and excessive weight loss during thyroid replacement therapy. Balance the client's periods of activity and rest, or encourage the client to be active to prevent constipation. So what are we thinking? All right, now let's think about hyperthyroidism. All right, what's another name for hyperthyroidism? Due to thyroid storm. Okay. Let's think about it. Let's think about it. Graves' disease, right? So when we think about hyperthyroidism, what are we thinking about? Hyper, Graves' disease, run, high everything, right? So think about it. Heat intolerance, too much thyroid hormone, high metabolism, right? So what's important? Oh, I see some people changing their answers. Oh, look at that. Look at that. Okay, all right, well, let's see what the answer is. Here we go in 3, 2, and the answer is C, the balance of the client's period of activities and rest. A client with hyperthyroidism needs to be encouraged to balance periods of activities and rest. Many clients with hyperthyroidism are hyperactive and complain of feeling very warm. That's actually that's a terrible rationale. Right. However, it's very true because everything is up. Right. And then they can start to have a metabolic issue. Right. Too much going on. They can run themselves into the grave. Everything that's hyper is up. Right? So they're having too much, not enough periods of times of rest. All right. Basic care and comfort, which is 6 to 12% on the NCLEX exam. Smaller section, but still very, very much important. These questions off of nurseslabs.com. You guys can go over there. You guys can check those out for yourself. They are free sets of questions. All right. Here we go. Question number 7. Nurse Chris is teaching a client with a history of atherosclerosis. All right. To decrease the risk of atherosclerosis, the nurse should encourage the client to what? Avoid focusing on his weight, increase his activity levels, follow a regular diet, or continue leading a high stress lifestyle. I laugh because as I read these, I'm just like, to me, it's that simple, but we meet everybody in different places. Everybody has a different education level and we meet them in a different place. All right. You got some B's and C's. Wish my doctor would say this. What you wish your doctor would say what? Shout out to all 179 of y'all. We are doing NCLEX questions. I got them off nurseslabs.com. Now let's break down this question, right? To decrease atherosclerosis, first we need to figure out what that is. All right. So we're talking about plaque inside of the body, inside of the vessels, right? How do we decrease plaque? Inside the body? All right. I want to encourage, as the nurse, how do you decrease the plaque in the body? All right. Now let's see what the answer is in 3, 2, and the answer is B, increase his activity, right? Because, activity, exercise, diet, and exercise, right, can decrease your plaque buildup inside of your vessels. All right. So shout out to y'all for getting it right. If you didn't get it right, some people are going to tell me, oh my God, Kevin, these are simple. Number 1, I didn't ask you that. Number 2, answer the question. Number 3, you have no idea what NCLEX is going to ask you. You don't. because they will ask you questions on a level from 1 to 4. All right. Remembering, right? Memorization, analysis, application. If you start getting to the lower level questions where you feel like they're really, really easy, you might want to take a step back and realize that, hey, these questions are starting to look really, really easy. Memorization type that I learned in nursing school, maybe I need to back up and start doing my critical thinking aspect, okay? So here we go. Question number 8, Nurse Greta is working on a surgical floor. Nurse Greta must log roll a client following a what? Laminectomy, thoracotomy, a hemorrhoidectomy, or cystectomy. What are we thinking? So now at this aspect, we need to know what these procedures are and what is the best way to log roll, or who's going to get log roll, right? Which one of these surgical procedures require log rolling? So I got some people saying A, I got some people saying B, all right? Hey, if you guys are just now joining, welcome. All right, welcome. My name's Kevin. I am a registered nurse. I have a BSN, if that really matters to you. I was in the Navy for 16 years. The last 9 of those 16, I was a master instructor. Taught in the Surge Tech program, and I taught in a bunch of other things. And I failed my NCLEX 3 times. Yeah. So the answer is A. The answer is A. It's a laminectomy because the client who has had a spinal surgery, such as a laminectomy, must be log rolled to keep the spinal column straight when turning. All right. When turning. All right. So that is part of physiological adaptation, which is the 3rd largest section on the NCLEX exam at 11 to 17%. But ladies and gentlemen, I failed my NCLEX 3 times. 3, not once, not twice, but 3 times. That's a shocker, right? I'm just letting y'all know it's okay. It's okay however you feel about it. It's okay that you failed, because guess what? Your job will never ask you. Your patient will never ask you. All right? You are your own worst enemy. Get out of your own way. You are your own worst enemy. Hey, give me the 20,000 likes. That's where we're going. Give me 100 shares. You know what I'm saying? You are your own worst enemy. Get out of your own way. When you fail, look at that performance breakdown to see where you didn't do well at. Look there. What's up, Naz? I see you. I'm so glad you're here, right? So get out of your own way, all right? Figure out what you aren't doing well. That way you can improve upon it. You got data, so use that data. What's up, everybody? Happy Nurses Week to all my nurses that are jumping in here. All right, here we go. Question number 9. A 55-year-old client underwent cataract removal with the intraocular lens implant. Nurse Oliver is giving the client discharge instructions. These instructions should include which of the following? Avoid lifting objects weighing more than 5 pounds. Lie on your abdomen when in bed. Keep rooms brightly lit. Or avoiding straining during a bowel movement or bending at the waist. What are we thinking? So this is one of those questions where we start talking about our eyes, right? All right. What are those things? We had an eye procedure. So what are the things that we want to avoid so our patient is at their most safe, right? A lot of these are right, but which one is more right? Do not want to put intraocular pressure. Okay. We got C and D. Is it Danny B? Thank you thank you, Danny. I appreciate your support. You should dim the lights. Now, Jolene. Now, ma'am, I think we need to have a conversation. All right. A or D. Now think about it. Which one of these is going to keep my patient safe? You have to think about the pathophysiology of this process of somebody who had an eye surgery. I'm going to give you guys a little trick to remember. Think about what happens when you sneeze and you hold your nose. Where do you feel the pressure? Think about it. Where do you feel the pressure? All right. When you sneeze and you feel the pressure and you hold in your sneeze, where do you feel it? Baby, in my eyes. Exactly my point. So if I had a person that just had an eye surgery, I want to avoid any type of strain or pressure that could be increased. That could be sitting on the toilet. Y'all know what I'm talking about, right? It could be sneezing, or it could be lifting or bending at the waist that would have them doing straining. So we should avoid straining, lifting heavy weights, and coughing harshly, right? Because these activities increase intraocular pressure. That's the whole point. We don't want them to do that because it could cause further injury to them. I got it on the first try. That's what I'm talking about. That's what I'm talking about. Shout out to you. Health promotions and maintenance, 6 to 12% on the NCLEX. All right, 6 to 12% on the NCLEX. George should be taught about testicular examinations during when? Is it during when sexual activity starts? At 69, at 40, or at 20? I'm sorry, after 69, after 40, or before 20. Hey, like I said, these are, hold on. Somebody said, wait, dimming the lights is wrong. So Jolene, let me ask you this question. Somebody who just had eye surgery, right? Do you want to have it where it's dim? Because they're not, if their lights are dim, they're not going to be able to see. All right. They're not going to be able to see. All right. I thought during puberty. Are you talking about this? Oh, I thought you were talking about the last question. I was like, oh, okay. No, it says D. All right, well, let's see what the answer is. Here we go. And the answer is D. All right, it is D. Testicular cancer commonly occurs in men between ages 20 and 30. A male client should be taught how to perform testicular self-examination before age 20, preferably when he enters his teens. So during puberty, absolutely. All right, health promotions and maintenance, 6 to 12% on the NCLEX exam. All right, 6 to 12% on the NCLEX. If you don't understand those, y'all got to circle back and y'all got to get them. Okay, hey, real quick, I got some test taking tips that are over there for y'all. Go check them out. Test taking tips, 42 pages. You get everything but the kitchen sink and this fanny pack. Oh my God, I just moved my computer. I'm strong, y'all. I'm strong. Hey, get a fanny pack. That's a handsome dude right there. Anyways, make sure y'all go over there. Y'all go check that out. Go get y'all some of that knowledge. All right. I'm trying to give y'all this knowledge. Here we go. Question number 11. Question number 11. A male client has undergone a colon resection. When turning him, wound dehiscence and evisceration occurs. Nurse Trish first response is to what? Was the very first thing that we do. There's a big difference between first and best. So first is systematic. So I see it happen. What is the first thing I'm doing, right? Do I call the physician? Do I place a saline-soaked sterile dressing on the wound? Do I take a blood pressure and pulse? Or do I pull the dehiscence closed? What are we thinking? What are we thinking? Hey, shout out to all 116 of y'all rocking. We are doing NCLEX questions. Make sure you guys keep smashing that like button. You guys share, you guys follow. That is a trifecta. Share it to Becky with the good hair. Look, I know Becky graduating with you and you don't like her. You know what I'm saying? But I might like her. You know what I'm saying? I might like her. Stop being greedy. Give her to me. And by that, I mean share the stuff to her so she can come over here and get this knowledge. God, why y'all gotta be so selfish? Anyways, all right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2, and the answer indeed is B. All right. Place a saline-soaked sterile dressing on the wound. Narcissistic. What are we talking about? What are we talking about? Who's narcissistic? It's really funny that people that call other people narcissistic don't even know what the definition of narcissism is. So that's hilarious. The nurse should first place saline-soaked sterile dressings on the opening wound to prevent tissue drying and possible infection. That's part of physiological adaptation. ATI says call doctor first. ATI lying. ATI is telling you that for ATI tests. And it depends on what the question is asking you. It depends on what the question is asking you. All right. So physiological adaptation, 11 to 17% on the NCLEX exam, making it the third largest section. All right. Hey, when you are training for ATI, those are training ATI tests while you're in school. All right. I personally don't like ATI. Hey, Naz, don't mute them. Just block them. I just found out I failed NCLEX trying to get over this hill still. Is it Knoxon? Hey, you're in the right place. Right here, we have a community. We build it up with one another. It's okay if you didn't do well on that exam. No one's going to care. No one's ever going to ask you, hey, did you fail NCLEX? I worked for 3 years and then I told people I failed NCLEX just because it slipped up in conversation. And they're like, what? Are you serious? Oh my God, right? So Kaplan says calling the doctor first isn't correct because calling the doctor is doing nothing. Exactly. You do nothing when it comes to taking care of your patient. So essentially, if I could do one thing and then not do anything, call the doctor. That's it. You know what I'm saying? Hey, shout out to Nurse Amber. Nurse Amber is the homie, the A1 since day one. She's going to be going live here shortly. Make sure you guys go over there and you guys check out Nurse Amber. All right. And we got some stuff planned out for y'all. So y'all make sure y'all stay tuned to both what we got going on. All right. Question number 12. Nurse Aubrey is caring for a client who has suffered a severe cerebrovascular accident. During routine assessment, the nurse notices Cheney-Stokes respirations. Cheney-Stokes respirations are what? Telling me, A, okay. It says progressively deeper breath followed by shallower breaths with apneic periods, rapid deep breathing with abrupt pauses between each breath, irregular breathing without pulses, or shallow breathing with an increased respiratory rate. Everybody's telling me A. All right, well, let's see what the answer is. I see Kiki up in here. Kiki. September Stone. Funny enough, I just studied this topic. Kay, look at that. And you should already know this answer then, huh? And the answer is A. Progressively deeper breaths, followed by shallower breaths with apneic periods. All right. Cheney-Stokes respirations are breaths that become progressively deeper, followed by more shallow respirations and apneic periods. It's physiological adaptation. All right. Physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. All right. Hey, listen. LPNs, you guys learn the same thing that the RNs learn when it comes to content. It's your scope of practice that's different. You need to know what you can and can't do and what you can and cannot accept. All right. What you can and cannot do and what you can and cannot accept. Here we go. Question number 13. Nurse B is assessing a male client with heart failure. All right. The breath sounds commonly auscultated in clients with heart failure are what? Is it tracheal, fine crackles, coarse crackles, or friction rubs? What do we think it is? What do we think it is? Shout out to everybody. All 108 y'all. We are doing NCLEX questions for those that are just now joining us. Make sure you guys smash that like button. You guys hit that follow button as well. All right. Give me a follow. Turn that notification on. I go live 3 times a week. All right. And share it. Make sure you guys share it. And also, I want to know who you are, where you're from, and where you're at in your nursing journey. Where are you? SSH Mentoring is in here. That's my other mom, y'all. Hey, business mentor, all around wonderful person. If anybody ever wants to learn about how to be an entrepreneur, that is the young lady to go follow. Sarah, I love you. All right. So what do we think the answer is? B. C. What are we doing? What are we doing? All right. Well, let's see. Joyce is telling me D. Joyce, I haven't seen you in a while. All right. C. Sahara, I see you. All right. Let's see what the answer is in 3, 2. And the answer is B. It's fine crackles. I'm sorry. I couldn't help myself. Fine crackles are caused by fluid in the alveoli and commonly occur in clients with heart failure. That is physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. All right. This is why I say you can use Archer, you use UWorld. They have really good in-depth rationales. Like nurseslabs.com, they are hit and miss. However, this can get you into the routine of preparing. This gets you into the routine of preparing. I'm all about preparation, all right? I'm a medical assistant who loves to learn with hopes of getting into nursing school someday or nursing someday. Hey, how about you turn that hope into an actual reality? Don't hope to do it. Put in the work and you're going to make it happen. All right, put in the work, sir, and you will make it happen. Trust and believe me, because we all believe in you. If I can become a nurse and a whole bunch of other folks that can become a nurse who really shouldn't be nurses, so can you, sir. So can you. Trust and believe. Question 14. The nurse is caring for Kenneth experiencing an acute asthma attack. The client stops wheezing and breath sounds aren't audible, meaning you can't hear them. The reason for this change is that what is happening? The airway or the attack is over. The airways are so swollen that no air can get through. The swelling has decreased or crackles have replaced wheezes. What are we thinking? Shout out to all 104 of y'all. Still doing NCLEX questions. We ain't gone nowhere. We still here. We still here. All right. I want to know who you are, where you're from, and where are you in your nursing journey. I'm a foreign nurse. Anxiety is my problem. A big way for you to get over the anxiety is to know thy enemy. I know what the NCLEX looks like. I know what the testing center looks like. I know vaguely what questions that they're going to be asking me. So I would prepare by putting myself in that environment. Know the terrain, as we say in the military, right? Know the grounds. All right. Put yourself in the situation of actually the testing center. That right there will help it tremendously. All right. All right. Let's see what our answer is. And the answer is B. The airways are so swollen that no air can get through during an acute attack. Wheezing may stop and breath sounds become inaudible because the airway is so swollen that air cannot get through. Listen, these rationales, not the best. Not the best. However, content. All right. Not only with content, right? Content is what you need in order to apply it to your questions and answers, right? You have to use that to analyze your questions in order for you to make a good clinical judgment. That's what the NCLEX test plan wants. It says it verbatim. All right. I graduated 3 weeks ago. Just got my my ATT. Shout out to you, Elaine. Shout out to you. Hey, you're one step closer to getting that license. All right. Here we go. Question number 15. Mike with epilepsy is having a seizure. During the active seizure phase, the nurse should what? So he's actively seizing out, doing his thing. All right. So what do we do as the nurses? Do we place the client on his back, remove dangerous objects, and insert a bite block? Place the client on his side, remove dangerous objects, and insert a bite block. Place the client on his back, remove dangerous objects, and hold down his arms, or place the client on his side, remove dangerous objects, and protect his head. Now think about this. There are 3 choices inside of each answer. If one is wrong, here's a test taking strategy. All right. Here is a test taking strategy. If one of these answers in this one answer choice is wrong, the whole answer is wrong. I'm going to say that again. If one of these answer choices if one of the answers inside of the answer choices is wrong, the whole thing is wrong. So you could have 2 that are right and 1's wrong, but the whole answer is wrong. All right. Now also think about it with seizures. Run it down. Go down the list. What is happening to a patient when they're having seizures, right? They're having uncontrolled movements. They could be foaming at the mouth. They have the risk of injuring their head or neck or anything like that, right? So what do I want to do? I need to protect that airway, right? I need to protect that airway. Laying them flat on their back, and if they have aspirations, could cause them to have an airway issue, right? So do we want to do that? No, we don't want to do that, right? We want to place them on his side, remove dangerous objects, and protect his head, all right? And that's what we want to do. That's the initial precautions that we want to do when a patient is having active seizing. Now, we cannot forget that we want to have suction, right? We want to have suction to protect that airway if they start foaming at the mouth, even if they're not foaming at the mouth. Make sure you have it. Make sure you have pads, right? You have paddings on the side of the bed. Some people will say no, but padding on the side of the bed, you'll see them on NCLEX questions, all right? So shout out to y'all for getting it right. Safety and infection control, which is 10 to 16% on the NCLEX, all right? 10 to 16%. So shout out to all y'all for getting that right. All right, hey, ladies and gentlemen, check me out. Free test taking tips. I'm going to tell you again, free test taking tips, 42 pages. That's an ebook that I'm giving for free. What are we doing? Go check it out. Test taking tips to conquer the NCLEX. You get everything but that fanny pack. If you want a fanny pack, it was like $6 at Walmart, or if you live somewhere else, you know what I'm saying? I don't know what they got in Canada. Do they got Walmart in Canada, Nas? Let me know. Let me know if they got a Walmart up there. Purpose driven. It says, I'm in New York, graduated from an accelerated program last year, recently took my NCLEX and failed. That's okay. That's okay. Okay, Nas, cool. Hey, go get you a fanny pack, Nas, for $6. Canadian, not US, because, So, purpose driven. The one thing I'll tell you that it's okay. It's okay that you failed. I failed my NCLEX 3 times. I'll tell all 87 of y'all, I failed it 3 times, passed on the 4th. Nowhere, anywhere did they care about the fact that I failed. The test doesn't determine what type of nurse that you'll be. Only you can determine that. All right. I got mine from Amazon. I feel like it. Never mind. All right. Here we go. Question number 16. All right. After insertion of a chest tube for a pneumothorax, a client becomes hypotensive with neck vein distension, tracheal deviation, absent breath sounds, and diaphoresis. Nurse Amanda suspects a tension pneumothorax has occurred. What causes a tension pneumothorax? Should the nurse check for? Is it an infection of the lung, kink, or obstructed chest tube, excessive water in the water seal chamber, or excessive chest tube drainage? What are we thinking? But as I was saying, it's okay if you fail that exam. It's okay if you fail the exam. All right. But you need to figure out. The NCLEX is all about nurse safety. And it's a very, very, very standard test about nurse safety. I don't expect for you to know everything. And neither does the NCLEX. All right. But you need to know enough, and you need to know what everybody else knows. All right. You need to know enough, and you need to know what everybody else knows. So, was it driven, purpose driven? When you get that performance breakdown, if you haven't gotten it already, I want you to read through it. I want you to see what areas or issues that you had. So if it's recognizing cues, that's telling me that you don't understand what signs and symptoms are being presented to you and what the vital signs look like for you to make a critical thinking a critical thinking thought to be like, oh, that could be this disease process. Oh, they have a blood pressure of 156 over 16 or 156 over 95. Oh, okay, they're hypertensive. What comes with hypertension? Probably atherosclerosis or something along the lines of that. That's how you have to think. That's how you use your clinical thinking in order for you to make a clinical judgment, okay? So kinks and blocks of the tube, all right, are common for tension pneumos, all right? So anytime you start to see them having difficulty, check the tube. Check the tube, all right? Just that simple. Check the equipment, all right? You look at your patient, and when you look at your patient, you're going to be like, okay, what's going on? Let me check my equipment. Patient before paperwork, patient before equipment. Reduction of risk potential, 9 to 15% on the NCLEX exam, making it the fourth largest section on the exam. LPNs, you learn the same content that RNs learn. You learn the same content. Thank you. I got it. Will do. Appreciate it. You are very welcome. My first NCLEX review. So this is your first NCLEX review like ever. Hey, I'm glad that you're here. I appreciate you. Here we go. Question 17. Nurse Maureen is talking to a male client. The client begins choking on his lunch. He coughs forcefully. The nurse should what? Stand him up and perform the abdominal thrust maneuver from behind, lay him down, straddle him, and perform the abdominal thrust maneuver, leave him to get assistance, stay with him, but not intervene at this time. What are we thinking? Hey, shout out to all 96 of y'all out here rocking. We're doing NCLEX questions. I need for y'all to smash that like button. I need y'all to hit that follow button and share the live. All right. We do these 3 times a week. Hey, we're on the road to 20,000 likes. If I don't have 20,000 likes by the time I get to question 20, I guess y'all are just getting 20 questions today. I guess. But I want to know who you are, where you're from, and where you are at in your nursing journey. Kay says, why do some of you guys think D? Is it because of the forceful cough? If he's coughing, he's moving air. Bree, let him know. Let him know. That's like somebody telling me that they can't breathe, but they're actively talking to me. Now, if they're telling you that they're having difficulty breathing and you can see numbers to prove that, then maybe I'm having a little bit something different. I bought your course 2 days ago. Best decision ever. I was lacking motivation to study. Karina, I love the fact that you just said that. Hold on, I'm going to pin you. All right. I'm glad that you like it. Hey, Karina, I'm going to be putting more stuff in there. Here comes soon. So, I got a bunch of videos that I'm going to be putting in there from different areas. So I appreciate that. And I'm glad that you like it. Hey, we're going live tomorrow. So we're going to be doing some NCLEX questions in the community. You should be a part of that. If not, we'll talk about that here. But the answer is D, stay with him, but not intervene at this time. If the patient is coughing, he should be able to dislodge the object or cause complete obstruction. If a complete obstruction occurs, the nurse should perform the abdominal thrust maneuver with the patient standing. That's part of safety and infection control. That was my first choice. So Sahara, what is my rule? What is my rule, Sahara? It's like 9 times out of 10, your first answer is your correct answer. We do not change answers. You have more. Usually your first answer choice is the correct one. So people change from incorrect or from correct to incorrect more than they change from incorrect to correct. Does that make sense? Yeah. Yes. Go with your gut. Sarah, I don't know how big you are. I got a pretty big gut. So if you have a pretty big gut, from beers and stuff, I'm just letting you know. No, I'm just playing. But go with your gut, y'all. Go with your gut. Here we go. Question number 18. Nurse Ron is taking the health history of an 84-year-old client. Which instruction will be most useful to the nurse planning for care? Is it general health for the last 10 years, current health promotion activities, family history of disease, or marital status? I am in an accelerated LPN program. It is my first session. Praying and working to pass. I know that's right. Praying and working, because guess what? You need both. I'm glad that you're doing that for yourself. And trust me, it's only the beginning. I can't say it'll get easier, but you will come to terms the further you get along. All right. And the fastest way to get through nursing school, ladies and gentlemen, is to graduate. The fastest way to get through nursing school is to graduate. All right. That's the fastest way. All right, shout out to everybody that's here rocking. We are doing NCLEX questions. Got them off nurseslabs.com. They are free sets of questions. All right, free sets of questions. You guys can go over there and check those out for yourself. Check them out for yourself. All right, here we go. And the answer is B, current health promotion activities. Recognizing an individual's positive health measures is very useful. Not a very useful rationale, but the whole point with the older population is to keep them moving, right? And current activities, when it keeps them moving, it keeps them moving, keeps the blood flowing, keeping it positive, being around a community of others, all right? So we want to make sure we keep promoting that, because also we still have to talk about, hey, do you drink alcohol? Do you smoke cigarettes? Do you do this? Do you do that? That's what we talk about with our older population, because we still have to provide the education and the opportunity for them to do things better in their lives. All right. So that's the most important thing based off of this question. Okay. Health promotion and maintenance, 6 to 12% on the NCLEX exam. So shout out to y'all for getting that question right. If not, circle back and read it. Circle back and read that information. Remember, I have 3 rules: RTF, RTFQ, RTFA, and RTFR. Who in the chat can tell me what it means? All right. Question number 19. When performing oral care on a comatose client, Nurse Karina should what? Apply glycerin, to the client's lips at least every 2 hours. Brush the teeth with the client lying supine. Place the client in a side-lying position with the head of the bed lowered. Or clean the client's mouth with hydrogen peroxide. What are we thinking? What are we thinking? I have 3 rules. I have 3 rules when it comes to studying. Who can tell me? I said RTF, RTFQ, RTFA, and RTFR. What are they? What are they? Come on. Hey, we ain't going to the next question until somebody tells me. We got A's and we got C's. Okay. We got A's and we got C's. Royal is telling me C. Brittany's telling me C. All right. All right. Read the effing question. Hey, you know what the deal is. It says graduating on Friday with my ADN. Glad to be done with nursing school. Jeremiah, I know that's right. Congratulations. Hey, you ain't done yet, sir. You ain't done yet. You got to get that license, and then you got to do that BSN, right? But guess what? You can do that BSN online on your own time. You see what I'm saying? All right, read the effing question. Hey, what about RTFA and what about RTFR? Who could tell me? But the answer is C, placing the client on the side lying position with the head of the bed lowered. It says, I thought they were talking to us. I'm talking to y'all. You're going to guess A. Getting ready to take my NCLEX as a Taria. Hey, you're almost there, right? The client should be placed in a side-lying position with the head of the bed lowered to prevent aspiration, all right? A small amount of toothpaste should be used and the mouth swabbed or suction to remove pool secretion. That's physiological adaptation. Physiological adaptation. All right, read the effing rationale. Yes. And then RTFA, read the effing answers. Because if you don't understand what the question is asking you, the answers can tell you. The answers can tell you what the question is asking you. Oh, I didn't read the coma part. Yeah. Sahara, just go ahead and stand in the corner. Go ahead. Go stand in the corner. All right. And then come back in about 2 minutes and we'll talk about, did we learn anything? All right. No, but physiological adaptation, 11 to 17% on the NCLEX, making it the 3rd largest section. Hey, these are test taking strategies I'm giving y'all. I'm giving y'all a game right now. I'm giving y'all a game, and I'm going to need for y'all to pay attention. All right. Here we go. It says, y'all got CMA exams at your nursing school? No. We don't do medical assistant stuff in nursing school. We don't do that. It's only for nurses. Medical assistant is for you get certified in that, and with nursing school you get a license. And if you go off of the hierarchy, the nursing license is held in higher regard than the certification as a medical assistant. Okay. Oh, content mastery assessments. Yeah. You got to let me know. No, CMA stands for Certified Medical Assistant. Don't be coming in here trying to change stuff. You just made that up, Kay. Here we go. Question 7. Question 20. 77-year-old client is admitted with a diagnosis of dehydration and change in mental status. All right. He's being hydrated with IV fluids. When the nurse takes his vital signs, she notes that he has a fever of 103, a cough that has yellow sputum and paralytic chest pain. The nurse suspects this client may have which of the following? Is it ARBS, myocardial infarction, pneumonia, or tuberculosis? All right. What are we thinking? So this is a perfect question when it comes to recognizing cues. All right. So what are the cues inside? What are the key things inside of this question? Name them. I want to see it in the chat. I want you to name them. We're not going on. I want watch it be D. Naz, if you don't stop it, if you don't stop it with the nonsense. Fever is one. That's a Q. All right. But specifically, the fever is what? It's 103, right? Dehydration is another one. But what's a really big one? There's two of them that are really big. Two of them that are really big. Change in mental status. Yes, that's huge. The sputum, the fever, the sputum, and the change in mental status, right? Huge. All of them are important, but it is huge. All right. It is huge. All right. Now let's see what the answer is. Oh, what'd I do? All right. But the answer indeed is pneumonia. It is pneumonia, right? Because if I see somebody who has yellow, brown, green type of sputum, that's telling me that they have an active infection in their lungs. It's nasty. It's nastiness. When you cough up anything, it's supposed to be clear. But if you start coughing up stuff that's dark colored, brown, green, yellow, that's nastiness. That's infection that we're trying to cough up, right? That is a cue of a pathological issue. Does that make sense? Hey, give me the 30,000 likes and stop playing games with me, all right? But y'all, that's how you have to recognize cues. I'm giving y'all a game right now. Y'all keep playing games with me, all right? So, pneumonia. Pneumonia is what? Is it viral or is it bacterial? Infection. Physiological adaptation, 11 to 17%. Physiological adaptation covers acute, chronic, physiological disease processes. Bacterial. So when we think about bacterial and we think about infection, think about if you had an infection on your arm. What color it look like? It's all white and brown and pus-like. It stinks, right? It stinks. You know what I mean? So think about it. All right, ladies and gentlemen, once again, go over there and get you some test taking tips. All right. Tell your mom, tell Mima, tell Pawpaw, tell your ex-boyfriend or girlfriend or whatever. Tell them to go get it. They may need it. They may not. I don't care. You just go download it, whatever. But it's free, 42 pages. It used to be one of my ebooks and I'm giving it away for free. You get everything on there except for that fanny pack. You not my stethoscope. That's a G.I. Joe head cover. You can get your own, whatever. Yeah, go over there and get that. Go get that free knowledge for yourself. All right. Here we go. Question number 21. Nurse Oliver is working in an outpatient clinic. He has been alerted that there is an outbreak of tuberculosis. Which of the following clients entering the clinic today is most likely to have TB? All right. Most likely to have TB. All right. Is it a 16-year-old female high school student, a daycare worker, a homeless man with alcoholism, or a businessman? It's a business. Hey, it's a businessman, not a business man. Okay. Anybody? No? Whatever. You're telling me it's definitely C. You know what? You might be right. Business. Business, man. Shout out to all 104 y'all. We're doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. I said it, free. F-R-E-E. All right, F-R-E. Go over there and check them out for yourself. Hey, if you are new here, I want to know who you are, where you're from, and where you are at in your nursing journey. All right, where you at in your nursing journey? Free 99. All right, here we go. Shout out to lovely LPN. I see that you just joined. Thank you for the follow. Here we go. And the answer is C. It's a homeless man with a history of alcoholism. Clients who are economically disadvantaged, malnourished, and have reduced immunity, such as a client with a history of alcoholism, are at extremely high risk for developing tuberculosis. That's part of health promotion and maintenance, 6 to 12% on the NCLEX exam. Smaller section, but very, very much important. By the way, all these categories, I could pull a question and have all of the client needs categories in them, but there's going to be one client need category that's going to presume over all of them with that exact question. All right. But this one is strictly pulled from this section, taking complete control over what category it comes from. Okay. Dang. I better chill on you better chill on it before you end up with TB. Hopefully not. But then again, we got meds for that. Here we go. Question 22. Virgie with a positive Maddox test should be sent for a chest x-ray. The nurse is aware that which of the following reasons is done, or this is done. Is it to confirm the diagnosis, to determine if a repeat skin test is needed, to determine the extent of lesions, or to determine if this is primary or a secondary infection? Whoa, somebody just subscribed to me? Toria, appreciate you. Shout out to you. I think you're the first person to subscribe for me. Shout out to you. All right, so what are we thinking, y'all? What are we thinking? Shout out all 100 of y'all. We're doing NCLEX questions. I want to know who you are, where you're from, where you're at in your nursing journey. Trust me, I need the help. Ma'am, hey, if you also need help, go check out my link tree in my bio. I got a bunch of stuff in there besides the free download. I got an ebook. I have a course. If you really need help and you want one-on-one, I do one-on-one NCLEX coaching. Everybody that wants to do that better jump on it now, because that one-on-one coaching is going away, and I'm going to be doing group coaching here come in the future. All right, fun fact, I've never known how to pronounce Maddox until now. There you go, Maddox. That's okay. I mess up words all the time. You should hear me say Adalecticus. I say Adoleticis. I'm pretty sure I mess it up all the time. But anyways, it is to determine the extent of lesions. If the lesions are large enough, a chest x-ray will show their presence in the lung. So here's the question. What is the definitive way? What is the definitive way to diagnose somebody who has tuberculosis? I need one-on-one. I leave bedside 15 years and I'm a foreigner. Okay. Hey, and I got you. If that's something that you need, check out the link in my bio. X-ray, you are incorrect. The definitive way to diagnose, to confirm TB is a sputum culture. Sputum culture. It is to cough up the nastiness out of your lungs into a tube sent to lab. That is how you confirm the diagnosis of tuberculosis. Putting y'all on game. I'm telling you right now, tuberculosis happens so much and it's so high and it's such a regular thing that you would see. Yes, 100% for active. Yeah, but they're going to do it all for active TB. They're going to do the Maddox test. The PPD test. They're going to do a chest X-ray, and they're going to do the sputum. They're going to do the sputum test. The chest X-ray shows the active and the latent period as well. All right, but the definitive way to show that you have TB is going to be a sputum test. All right, here we go. Kennedy, with acute asthma showing inspiratory and expiratory wheezes and a decreased forced expiratory volume, should be treated with which of the following classes of medications right away? Is it a beta blocker, a bronchodilator, inhaled steroids, or oral steroids? What are we thinking? What are we thinking, man? All right, everybody's telling me B. Everybody's telling me B. All right, well, let's see. Let us see what the answer is. Let us see what the answer is in 3, 2, and the answer indeed is B, because bronchodilators are the first line of treatment for asthma, because bronchoconstriction is the cause of the reduced airway. That is part of physiological adaptation, which is the third largest section at 11 to 17%. LPNs, you need to know what you can and cannot do and what you can and cannot accept. All right. As well as you learn the same content as the registered nurse, but your scope of practice does not allow for you to do what the registered nurse can do. All right. You're still a nurse. Don't get it twisted. All right. Here we go. Question number 24. Mr. Vasquez, a 53-year-old client with a 40-year history of smoking 1 to 2 packs of cigarettes per day, has a chronic cough producing thick sputum, peripheral edema, and cyanotic nail beds. Naz, don't you smoke like 2 packs of cigarettes? It doesn't matter. Based on this information, he most likely has which of the following conditions? Is it ARDS, asthma, chronic obstructive bronchitis, or emphysema? The largest section on the NCLEX is management of care for RNs, and it's coordinated care for LPNs. Actually, I quit smoking 10 years ago. Ew. I mean, good for you. I'm so proud of you, Naz. I'm so proud of you. No, I look. This is a no judgment zone. This is a no judgment zone. Y'all do you. As long as y'all ain't out here hurting nobody, you keeping it right, you keeping it positive, going in a positive direction. Hey, you do you. You do you. Boo. All right, here we go. Let's see what the answer is. Let's see what the answer is in 3, 2, and the answer is chronic obstructive bronchitis. Because of this extensive smoking history and symptoms, the client most likely has chronic obstructive bronchitis, which is a physiological adaptation at 11 to 17%. 11 to 17%, making it the third largest section on the NCLEX exam. Management of care or coordinated care, pharmacological imperative therapies, physiological adaptation, and then reduction of risk potential. Those four right there make up almost 60% of the entire exam. Almost 60%. All right. So make sure as you are answering your questions, look for those cues inside of the question. Read your question all the way, because one word can change the entire answer. All right. Pay attention to those. Here we go. Question number 25. Francis, age 46, is admitted to the hospital with a diagnosis of leukemia, chronic lymphocytic leukemia. All right. The treatment for patients with leukemia is bone marrow transplant, right? Which statement about the bone marrow transplant is incorrect? So here's a way that you can read this. It's asking us which one of the statements is incorrect. So is it incorrect that the patient is under anesthesia during the procedure? Is that incorrect? Is it incorrect that aspirated bone marrow is mixed with heparin? Is it incorrect that the aspiration site is in the posterior or anterior iliac crest? Or is it incorrect that the recipient receives a cytoxin for 4 consecutive days before the procedure? All right. So whichever one is not incorrect is your correct answer. All right. Everybody's telling me B. All right. Well, let us see what the answer is. Let us see what the answer is, y'all. Let us see in 3, 2. You're going to guess it's B. Hey, guess it's B. But also think about it. Think about what we know, or think about what you know about leukemia. Think about what you know about leukemia. Here's another test taking tip. Apply what you know versus trying to apply what you don't know. Apply what you know. And if it's in there, you cross it out. So now your process of elimination is going based off of what you know. And then if you truly don't know, then you can make an educated guess. But now instead of 25%, you have a 50% chance of getting it right. Okay, here we go. And the answer is A. The client is under local anesthesia during the procedure. Oh no. Oh no. Why? All right. So before the procedure, the patient is administered is administered with drugs that would help to prevent infection and aspiration of the transplant cells, such as antibodies, cytotoxins, and corticosteroids. During the transplant, the patient is under general anesthesia. Now, let me ask you this question. They are drilling into your body, right? They are drilling into your body. Now, let me ask you this question. Would you want to be under local, or would you want to be under general anesthesia? Very tricky question. You got to pay attention. GYATTT. You got to pay attention. That's why we read, or we RTFQ and we RTFR. It says, makes sense now that you say it that way. That's what I'm saying. Think about it. It says like, hell no, not the local. That's crazy. Look, I'm trying to tell you. That's just like somebody drilling into your arm and they're just like, hey, I'm just going to give you this numbing medication. It should be fine. Absolutely not. Absolutely not. Because your body is going to naturally do what it does, and it's going to tense up, right? Your body needs to be relaxed for that. That's what general anesthesia does. They give you your relaxation medicine to put you off to sleep, and then they put you on a muscle relaxer, or a paralytic, VEC or ROC or succinylcholine, whatever, right? So that's why, listen, your body's going to be, even if you're asleep, your body will be like, nope, get off me. All right. Test taking tips to conquer the NCLEX. Stop playing with me. Go over there. Hey, thebootnurse.com/test. 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 Some of y'all need for me to talk to y'all like Dr. Umar, and I'm going to need for y'all to go get that. All right. I'm just saying. All right. So here we go. Question 26. After several days of admission, Francis becomes disoriented and complains of frequent headaches. The nurse in charge first action would be to what? All right. Call the physician, document the patient status in his chart, prepare oxygen treatment, or raise the side rails. not Dr. Umar. Listen. All right. 207. Listen. Okay. All right. Naz is telling me D. We got some C's. We got some A's. Now let's think about it. What Q do I recognize? What is the Q in here that I recognize? Tell me right now. I should be having, it says this is Harks. No, it's not Harks. How many side rails? That's not even what I asked you. Disoriented. All right. So disoriented means what? That means I have a altered level of consciousness. I have an altered mental status. Could be confusion, right? They are what? They are what? Ooh. They are what? Indeed, they are a fall risk, right? A patient who is disoriented is at risk for falling out of the bed. The initial action of the nurse should be to raise the side rails to ensure patient safety as part of safety and infection control. Safety and infection control, all right, which is 10 to 16% on the NCLEX exam. Starting to go towards the lower section, but still very much important, all right? We need to make sure that when the patients are in our care, all right, that we make sure that we have all these things in place for a reason. All these things are in place for a reason. Shout out to all 328 of y'all. We're doing NCLEX questions. Hey, TikTok bestie, what's up? Hey, Nurse Cass is in the building, y'all. She works corrections and she will fight you. I promise you. She tried to fight me and I lost. So shout out to you, Nurse Cass. I missed you, Miss Lady. All right, here we go. Question number 27. During routine care, Francis asked the nurse, how can I be anemic if this disease causes increased white blood cell production? The nurse in charge, best response would be that the increased number of white blood cells is what? Is it crowded with, red, hold on one second, red blood cells? Is not responsible for anemia, uses nutrients from other cells, or has an abnormally short lifespan of cells. Hold on, y'all. TikTok is not letting me be great because they're like, hey, are you still live? Of course I'm still live. The hell you think this is? Netflix? Are you still watching? Bitch, I am still watching. Here we go. What do we think the answer is? Hey, shout out to all 270 y'all. We are doing NCLEX questions. We're on the road to 30,000 likes. Make sure you guys smash that like button. You guys share, you guys follow. We're on the road to 30,000 likes. All right. I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, what are you doing here? What are you doing here rocking with me? Shout out to all my nurses. Happy Nurses Week to y'all. Florence Nightingale, we trust. Not really, because if you read up on her, there's not a lot of good things that she did sometimes. But that's okay. But here we go. Our answer is A. Crowd red blood cells. The excessive production of white blood cells crowd out red blood cells production, which causes anemia to occur. Physiological adaptation. Physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. All right, 11 to 17%. Not a nurse, but taking billing and coding. This is interesting to me, so don't mind me. Kim, you good. You good. You could participate. You can participate. I want everybody to participate. I don't care where you are, as long as people aren't rude and disrespectful to where other people are in their learning journey. All right. Just graduated nursing school on the 4th, and I'm preparing to take the NCLEX as we speak. Jack, that's what I'm talking about. That's what I'm talking about. Keep pushing. All right, here we go. Question number 28. Diagnostic assessment of Francis would probably not reveal predominance of lymphoblasts, lymphocytosis, abnormal blast cells in the bone marrow, or elevated thrombocyte count. Been a nurse for 5 years. NCLEX review is just fun for me. Chill. Your name is Chill. I'm about to tell you, like, chill. That's what's up. That's okay, though. It's all right. Hey, just because you're an RN or an LPN doesn't mean you can't just come up in here and just keep getting your learn on and just listen, you know? Or, of course, participate in the chat, because that's what it's about, you know, giving back that knowledge to those people that are trying to be where we are. Nikki from Palm Beach, Florida, taking NCLEX PN in 4 weeks. Shout out to you, Nikki. Shout out to you, Nikki. All right, y'all. This question, indeed, is based off of the last one. It is based off of the last one, yes. All right. I'm going to give you guys 5 more seconds. That's what I'm doing, just learning. That's okay, Grandma Jill. Just come over here and get your learn on. I welcome everybody, as long as you don't come in here and be rude. Because if you're rude to me, best believe I'm going to be rude to you. And if you're rude to anybody else, I'm going to be rude to you, and you're not going to like it. What's up, Samantha? What's up? All right. And the answer is B. It is leukocytosis. Chronic lymphocytic leukemia is characterized by increased production of leukocytes and lymphocytes, resulting in leukocytosis and proliferation of these cells within the bone marrow, spleen, and liver. Whoop, whoop. Shout out to you, Sahara. Hey, reduction of risk potential. Reduction of risk potential, which is 9 to 15% on the NCLEX. All right, LPNs. I'm going to tell you again, you guys learn the same exact content that registered nurses learn, okay? You learn the same exact content that registered nurses learn. You learn the same exact content that registered nurses learn. Your scope of practice is different. You need to know what you can and cannot do and what you can and cannot accept. All right? What you can and cannot accept. All right? Here we go. Question 29. Robert, a 57-year-old client with acute arterial occlusion of the right leg undergoes an emergency embolectomy. 6 hours later, the nurse isn't able to obtain a pulse in his left foot during or using a Doppler ultrasound. The nurse immediately notifies the physician and asks her to prepare for the client for surgery. As the nurse enters the client's room to prepare him, he states that he won't have any more surgeries, which of the following is the best initial response by the nurse? Does it explain the risks of not having the surgery, notify the physician immediately, notify the nursing supervisor, or record the client's refusal in the nursing notes? Oh my God. All right, y'all. Miss G is up in here. Don't listen to nothing that she says, because she's about to be in here acting a fool. So, but everybody, I got a bunch of people telling me A, we got some B's, we got some C's. You hate it here? Then leave. How about that? Then leave. Then leave. Everybody's telling me A. Thank you for the heart, me. I appreciate you. No, wasn't A out of our scope of practice. It's the job of the surgeon to explain it. We're going to talk about this. We're going to talk about this one. Elephants. All right. So in this one, the answer indeed is A. However, the question is asking you, what is the first initial? You're going to call the provider. Listen, Sarah, hey, whoa. Hey, whoa, calm down. Right? Now, I don't like this question. Hold on. I don't like this question. This question is very much incorrect. All right. Because you will call the doctor. Calling the physician is they're going to be like, I don't want to have the surgery. What do you mean you don't want to have the surgery? I don't want to have surgery because I don't want to do it. Okay. You do know. Okay. Well, let me call the doctor. There it is. This question is ridiculous. I agree. I don't disagree with you. I don't disagree with you. All right. Now, this is one of those questions where I if I see one and it doesn't look right, I'll omit it. I've been meaning to take this out for a while and I just haven't. But the correct answer is indeed you will call the doctor for sure. This is not time for education. Emily, excuse me? Do you not realize that I'm an educator educating you? What do you mean? I'm going to need for you to really elaborate. on that statement because this is all I do is educate. I'm just saying. All right. Hold on. Go ahead. Hey, come to the front of the class. Oh, she means I think she's talking about oh, okay. All right, Em. All right. We Gucci. We good out here. Did she really say that? We good? Hey, we could. She's like, I like this. Love your personality. Look, Nikki, this is what I'm about. Listen, sassy nurse Kevin. No, I'm not sassy. You know what I'm saying? But I don't play about me and mine. You know what I'm saying? But the thing is, I want to make sure that y'all are good. All right. Like no shade. I promise. No shade. We good out here. Say, don't get it twisted. Listen, don't get it twisted. Gee, if you hate it here, then leave. Okay. No, here we go. Question 30. During the endorsement, all right, which of the following clients should the on-duty nurse assess first? Meaning during the report. Hey, understand what these other words mean. All right. So during the report, which of the following clients should the on-duty nurse assess first? Is it a 58-year-old client who was admitted 2 days ago with heart failure, who has a blood pressure of 126/76, has a respiratory rate of 22 breaths per minute? An 89-year-old with end-stage right heart failure, blood pressure is 78/50 and has a do not resuscitate. A 62-year-old who was admitted 1 day ago for with thrombophlebitis and is receiving heparin, low volume heparin, right? Or is it a 75-year-old who was admitted 1 hour ago with a new onset of AFib and is receiving cardiazem or diltiazem. What are we thinking? Samantha, you got to give me one. You got to give me one. All right. Now, here we go. All right, Emily, we about to do some education. You ready for it? I'm just messing with you. Here we go. Check it out. Now, let's recognize our cues. Let us recognize our cues. All right. Somebody's saying it. Y'all are saying it. Hey, by the way, y'all need dosage calculations. Y'all need help understanding that med math. Hey, Nurse CC is in the building, a blessed RN. She is the dosage calculations queen. In her kingdom, she rules all. All right. She said, please let it be D. All right. So think about it. All right. What are the expected outcomes for somebody who had heart failure, but they had it 2 days ago, but they have normal vital signs? Is that something that I need to assess first? Probably not. Probably not, right? Think about it. Think about it. There goes Nurse CC right there for anybody that needs dosage calculation, right? They are stable, absolutely. Now, I have an 89-year-old person with end-stage right-sided heart failure who has a blood pressure of 78/50, but they have a DNR, all right? Is that somebody that I would want to see first? Because a DNR means what? I mean, he's old, he has an end-stage disease, he has low blood pressure on the low end, but he has a do not resuscitate, which means we do not use our resources on this patient. Right. So would that be somebody I would want to assess first? Probably not. All right. And then I had somebody who is admitted 1 day ago with thrombophlebitis and is receiving low volume heparin. All right. They had thrombophlebitis 1 day ago. That's all I got. Right. 1 day ago, and they're on low volume heparin. Right. So is that somebody that I would want to see first? Probably not. Probably not. Now, let's apply what I know. I have a 75-year-old. His age is irrelevant at this point. However, he has a new onset that happened an hour ago. A new onset that happened an hour ago. All right. So that tells me that it is not chronic. It is acute. It is not chronic. It is acute. There you go. So, and it happened an hour ago. And then we think about atrial fibrillation. Now I want you to really break it down. Now, what is atrial fibrillation? All right. What is it? What happens if AFib goes uncontrolled? I'm about to put game on you right now. So if I have uncontrolled AFib, right, which is I have a chaotic P wave, right? I have a chaotic P wave that's happening in my atrias, right? And I have the SA node that's circulating in the atrias, not getting good cardiac output. And the blood's not circulating. So what happens to blood when it doesn't circulate? It coagulates with the chances of creating clots, right? And with the chances of it creating clots, where could it go? Top pulmonary embolism, right? And then what else? What's another one? Arrhythmia. So he's already in an arrhythmia, right? Pulmonary embolism, brain. So we're thinking about an ischemic stroke, right? Backed up in the lungs, right? We're thinking about the brain, right? So this person is receiving a low volume diltiazem or cardiazem, right? Which is a cardiac medication, right? Which can help alleviate a patient that has atrial fibrillation, right? Remember, with atrial fib is a chaotic P wave. All right. So we want to unchaotic that P wave. Does that make sense? But somebody who's going to be on AFib is also going to be on a what? I'm putting y'all on game. They're also going to be on what? All right. They're going to be on tele. Yeah, but anti-EKG. Yep. We know they're on the EKG because that's how we know they have AFib. They're going to be on an anti-coagulant money. That's what I'm talking about. There we go. There it is. You're right. Shout out to y'all for getting that question right. I'm so proud of y'all. All right. So here we go. All right. The client with atrial fibrillation has the greatest potential to become unstable and is on IV medication that requires titration. All right, because diltiazem is a titratable medication. This patient is unstable. LPNs, you would not take this patient. And if you had a patient who ended up having atrial fibrillation, that patient no longer is yours and it has to be given to the registered nurse. That is part of management of care. Management of care, which is the largest section on the NCLEX exam at 15 to 21%. LPNs, It is 18 to 23% on the NCLEX PN exam. Still the same exact. I could re-ask this question and say, which patient would the LPN report to the RN? And it would be this patient. Does that make sense? Does that make sense? You know what I'm saying? Hey, shout out to y'all for being out here, being a part of this, man. Look, hey, but listen, that is what NCLEX wants. That is how you use your critical thinking in order for you to make a clinical judgment. It's all about nurse safety. It is all about nurse safety. There you go. Thanks for that's how you do it. That's how you do it. All right. Ladies and gentlemen, hey, remember how I told you I failed the NCLEX? Well, I wrote a book. I wrote a book talking about it. My journey of becoming a nurse. And my three failures and how I was able to overcome that. All right. I was able to overcome that. Right. And I told this story because I never want anyone else to feel how I felt. Right. I never want you to feel how I felt. And it doesn't even have to be about NCLEX. It can be about anything you're going through in life. All right. But hey, it launches June 5th, and it's actually available on Amazon right now. You can get it on Kindle, but then when the paperback version is available, you can switch your pre-order over. All right, but it's a motivational book, and this book is for my nursing students and my nursing graduates specifically, but anybody can read it. All right, Raquel, thank you for the roses. Appreciate you. I have 4 failures, but I'm still going. That's what I'm talking about, is it, Natari? Hey, keep going. Keep writing your story. This is my story. All right. And I want to be able to share that with each and every one of y'all. So you guys can go to the link in my bio and you guys can pre-order right now. It's $14.97. And you guys can pre-order for the Kindle version if you guys want to get that. Hey, go over there and get your test taking tips. All right. Go over there and get your test taking tips to conquer the NCLEX. All right. Go get it. Minus the fanny pack and my head cover because I've had that for a while, but whatever. And of course, ladies and gentlemen, I was on a podcast and it actually launched on Monday. It's called the Nursing Uncensored podcast. I talk about my experience in critical care. I talk about NCLEX prep because this is what I'm here doing for y'all. And I talk about building the community because that's what I'm doing with y'all here on TikTok and off of TikTok. All right. So make sure you guys go over there and give it a listen. I think there's already been like 2,000 downloads and it wasn't even up there for a whole day yet. So make sure you guys go over there and check Nurse Adrian out on Spotify, iTunes, whatever you guys want to listen to. All right. And then, of course, ladies and gentlemen. All right. I appreciate you guys hanging out. That's a wrap for today here on this Wednesday. Hey, I'm going to do an Ask Me Anything here in a second. All right. I'll turn this camera around so you guys can look at my disgustingly hideous face. Right. But I appreciate you all being here. I appreciate all the love, the likes. While the gifts are not required or mandatory, they are 100% appreciated. Naz, girl, I got you. Bria, I got you. All right. Hey, if I banned you, somebody got banned because they said something stupid. Hey, if you say some stupid shit, I'm going to ban you. And that's on the dead homies. I mean, you know what I'm saying? Once again, I got these questions off of nurseslabs.com. They are free sets of questions. You guys can go over there and check them out for yourself. I already talked about the podcast. I have an NCLEX course, ladies and gentlemen, that you can get. It's $97. It's yours for a lifetime and for however long your life is. Hopefully it's long and plentiful, so you get to keep it forever, all right? I do NCLEX coaching and I have an ebook. You guys can check that out as well. All right. Call him cutting up, Kev. Stop. I really do be cutting up. I watched the roast that they did for Tom Brady. And it was by far one of the most hilarious things I had ever seen in a very long time. It's a lot better than that Cat Williams stand-up, let me tell you. But what's up, everybody? Shout out to all 80 y'all here rocking. I'm going to hang out for a little bit to answer a couple of questions. Your boy got a haircut today. You know what I'm saying? So now I really am cutting up because I feel a little bit better. So if you guys are just now joining, my name is Kevin. I've been a nurse for almost 4 years. I worked ICU, OR, and PACU. How can I get the ebook? So if you click my face right here, and then you click my face again, it'll take you to my main page. And then click on where it says the link tree, and then you'll see my ebook. It'll say the NCLEX Victory Guide, and it'll say ebook. Let's see. Never give up. Naz, you're welcome. You're welcome. You're welcome. You came late. Raquel, you know better. I start promptly sometimes. This was awesome. Is it Martha? You're welcome. I do be cutting up. Let me see. Kevin Rather. I don't know what that means. You ignore my question. Naz, what was your question? I'm sorry. I didn't see it. Is this daily? No, it's Monday, Wednesday, Friday, 5:30. It says, like your flag shirt. I appreciate that. I've had this shirt for a while. I think I got it at, Under Armour, I guess. Or I got it I got it somewhere. It wasn't at Under Armour, so looking good, Nurse Kev. Stop it, Bria. I appreciate you, though. Is the course live or is it on demand? They're on-demand videos. But I have 80 videos that are up there right now. 80. Yep, nice haircut. I appreciate you. Just passed my nursing final today. Bree, that's what I'm talking about. Shout out to you for passing that exam. Congratulations to you. All right, my school let me retake my ATI exit today, and I got an 87. I still don't feel ready for the NCLEX though. So, Stone, what I would recommend is get you a set of questions and then get my review. Check my review out. Go check it out. Get it for 97 bucks. I like Archer because it's not so heavy on the pockets. Archer works. It does work. I'm joining today. Go join that thing today. Go join that thing today. All right. Congrats to Bree. You're welcome. Taria, I would tell you the same exact thing. Go join. Go check out the review for yourself as well. Go check that review out. All right. Hey, but what questions do you guys have today here on this Wednesday? And I'm letting y'all know right now. Me and Nurse Amber got some stuff coming up for y'all. I know I keep talking about it, but me and Nurse Amber got some stuff coming up for y'all. So I'm going to need for y'all to be locked in. Lock it in. All right. Lock it in. But like I said, what questions do you guys have for me? Thanks for the heart, me. I appreciate you. Who's that? Grandma Jill? Jill, you can be my grandma, whatever. So, now, hey, and of course, if anybody needs help with dosage calculations, of course, Nurse CC, a blessed RN, is in the building. She is the dosage calculations queen. She will get you right. All right. She will get you right. Jack says, great review. Definitely dropping a follow. I accepted a new grad position in a CCU. Any tips? So, Jack, what I would tell you is I'm going to tell you exactly what Larissa says. You probably don't know her, but she said, be a nurse's nurse. All right. Be a sponge. Help out everywhere. Ask as many questions as you can. Find a mentor on that floor who is going to guide you, right? Because what's going to happen, because you're going to be in imposter syndrome, and you're going to be in imposter syndrome for quite some time. So you want to be able to find somebody who can mentor you and guide you properly. All right. Not everybody's a good teacher. Thank you for the team bracelets. I appreciate you. Not everybody knows how to teach. Hell, not a lot of people want to teach. All right. So find you a mentor, male, female, doesn't matter who it is, and have them guide you. All right. And realize that where you are right now, it's okay. It's a part of the process. It's a part of your process. Right. And then the next thing I would say is definitely get enough sleep, drink a lot of water, stay away from the energy drinks and the coffees. I don't care what they tell you, because I'm telling you right now, nursing is manual labor. Working bedside is manual labor. You hear me? You hear what I'm trying to tell you? Nursing is manual labor. And I want for y'all to be able to get through that manual labor aspect. Listen, my whole goal is to get you a license so y'all can come out here and see the vast opportunities that you can do with a nursing license. You don't only have to work bedside, ladies and gentlemen. You don't only have to work bedside. You know what I'm saying? There are so many opportunities that are out here for yourself. All right. You can come out here, create an NCLEX review like me. You could do dosage calculations and do coaching like Nurse C, a blessed RN. You could be with Larissa, where she show you how to get in the nursing school, and she show you how to make money using your nursing money. Right. You can be, you could be you could be a stud in the gym and use your nursing license and integrate it with nutrition. You see what I'm saying? There's so many things like that. That license right there is like the credential that it's like the minimum of credentialing that you would ever need. You see what I'm saying? So definitely look at that. Nurse Slay Nurse says, amen. Yes, Lord, praise him all day, every day. All right. But Jack, hopefully that answered your question. If you got any other questions, just shoot me a DM and I'll try to answer them as best possible. But hey, if you guys are just now joining, we did NCLEX questions. My name is Kevin. I'm a registered nurse. Been a nurse for almost 4 years. By the way, I am an award-winning author. Talk about imposter syndrome. That's weird, right? I am an award-winning author. Gold seal. Put a stamp on it. So yeah. It says, how can I get the free download? So if you go to the link in my bio, boop, right there. And if you tap my face again right here, boop, and then go to where it says the link tree, like on my main page, it'll say free download, right? Click on there and then you'll see all the stuff that I have. And it'll say right there, free download. It says absolutely already absorbing what you're saying. That's what I'm in my Denzel voice. All right. Hey, you're gonna do fantastic, all right? And when those moments come where you feel like you're not doing fantastic, keep telling yourself that you are, and you're right where you're supposed to be. You're right where you're supposed to be. Thank you for everything. Hannah, you are welcome. You're welcome, Hannah. So shout out to all 46 of y'all. Of course, if you're just now jumping in, I want to know who you are, where you're from, where you're at in your nursing journey. What questions do you have about getting into nursing school? Going through nursing school, NCLEX, that's what I specialize in. First year working as a nurse, side hustles working as a nurse, so what questions do you guys have while I'm hanging out here for a while? Anna, what's up? What's up, Anna? It says, you gave me the confidence to take NCLEX again. I failed 3 times. Hannah, that's what I'm talking about. That's what I'm talking about. Listen, if I can affect and I could help one person by giving you my experiences and you go forth and you conquer, I know that I did my part. All right. This is why I try to say some people out there are just really selfish. And that's okay if they're selfish. It's not their place to want to give back to others. But the people that truly give back to others and to their community, there's nothing better. So Hannah, I'm really happy that I'm happy for you with that, because now you can still go out there and you can do your thing. All right. Remember, you're delayed, never denied. All right. So, hey, we've been on for 90 minutes, y'all. Y'all already know what the deal is. All right, cool. So since y'all ain't got no other questions about nothing, I appreciate everybody for rocking with me. Make sure you guys go check out and see what I got going on. I got a whole bunch of stuff going on. I got a whole bunch of stuff coming up. I just found you and literally tested today, and I have been in tears all day. Brooke, wipe those tears off your face, because guess what? The results are in. This is like Maury. Hey, let us find out what's really going on, right? It's okay. It's okay for you to cry. Hey, here's one. Brooke, what I want for you to do is I want for you to go onto my main page, and I want you to scroll all the way down where it says POV after taking NCLEX, and I want you to watch that video, and I want you to come back. It's not long. It's probably like maybe 30 seconds. I want you to go over there now, and I want you to look at it and tell me if that's you. Oh my goodness. But anyways, like I was saying, I appreciate everybody for jumping on. Make sure you guys go follow me on YouTube. You guys can do that. The link is in my bio. Make sure you guys follow me on Instagram. That link is also in my bio, because we don't know what's going to be happening with TikTok. All right. We have no idea what's going to be happening with TikTok. Do you have LPN assessment? What do you mean? I test. I'm tomorrow. You're tomorrow. I'm Kevin. Nice to meet you tomorrow. Thanks for this. Hey, Joyce, you are welcome. You are welcome. Do I have LPN assessment? What do you mean, user 61? So I would recommend, it says, can you give any advice? I don't know exactly what advice you want me to give. Like, are you talking about like a head to toe assessment? Are you talking about like how to prepare for NCLEX? Are you talking about an assessment, like a test? Like, what are we talking about? I will go after 2 weeks going for NCLEX. Oh, so you're asking, Naz, it says Kevin got it. All right, Naz, go do your thing. Go be the microbiologist I know that you can be. I'm proud of you, kid. I'm taking my exam tomorrow. Any advice? Okay, so let me answer user 61's first. So yeah, my course, it works for both LPNs and RNs as well. It does. It works for LPNs and RNs as well. And my advice to you is to study those areas that you have the hardest time with. So as pharmacology, I would study that content. And you need to, hey, listen, you need content, you need questions and answers, and you need rationales. You need those 3. I don't give a shit what anybody else tells you. There's no trick to studying for this exam. It's called putting in the work. That's what it is. And if you, there's no tricks, there's no cheating, there's no nothing. If I ever found anybody that cheated on NCLEX or paid their way to become a nurse, I'm that dude, because of what I had to go through. And so you could just buy your way in. I don't think so. No. And that's unsafe. It's very unsafe. So what I recommend to you, studying those areas that you have the hardest time, putting yourself on a schedule. You need content, you need questions and answers, you need rationales, and you need to be studying consecutively. So if you're going to be studying questions every day, do that, or every other day, do that. I'm taking my exam tomorrow. Any advice? Well, Abdullah, first of all, you shouldn't have been here, because I consider this cramming, so you shouldn't have been here. That's number 1. Number 2, I Would recommend for the rest of the night, just relaxing. I don't know what time your exam. How can I contact by phone? I don't take phone calls like that. The only way that people can really get in contact with me is if you're trying to if you want to do coaching. I do a discovery call, but in order for you to do that, you have to go to my link in my bio all the way through, and you have to go to where it says NCLEX Coaching and Mentoring. All right. But Abdullah, for you, I would not do anything for the rest of the day. Like, just relax. Play with your kids if you have kids. Watch anime. That's what I did. Do whatever you need to do to relax, but then prepare everything the night before. Lay your clothes out. Make sure you have your ID card, your keys, because usually on test days, whatever can happen may happen. So I'm prepared for that. All right. Go to bed early, right? Don't drink any coffee, no Monsters, no nothing like that, because when you go take your test tomorrow and you try to drink coffee, I don't know how your digestive system works, but the last thing you want is to get to question 10 or right when you get there and you got to go send the whole bathroom into orbit. You see what I'm saying? Yeah, I said it. So think about that. What is the NCLEX Victory Guide? So the NCLEX Victory Guide is an ebook over 782 pages. I kind of went overkill. But so essentially what it is, it's an ebook that goes over everything that you need to know for NCLEX, from management of care, delegation, supervision. It goes over a lot of pharmacology. It goes over EKGs. It goes over growth and development. It goes over all the important sections that you need for NCLEX. Joyce. So that's what that's for. I have passed Archer, CAT, and assessment. It's good to go for NCLEX. Yes, I would think so. All right. If you were taking all of your quizzes and you started showing consecutiveness of growth. So like, let's say you were scoring, like, overall scores were like in the 40s, and now you're like in the 50s, 60s, and you're like in the high 60s to 70s. And then you're doing really well on your CAT exams, and you did really well on your readiness assessments, and it shows likelihood of passing. You're good to go. You're good to go. Now, you know what happens to people when they see those? They go to the exam and then they get nervous, and they allow their nerves to mess with them. And then they end up making bad decisions and wrong answer choices. All right. I'm going to need a lot of ink. Thanks. I need this, Joyce. Absolutely. Absolutely. Here's what I'll tell you, Joyce. If you can print that out, like at work somewhere where you ain't got to pay for it, or somebody else's work we ain't got to pay for it, I would recommend that. Or you could send it to like, what is it? Not Home Depot, but like FedEx or UPS, they can print it out too. Radiation assessment. Hi. I did all 4. Shout out to you. You're welcome. I will be doing my NCLEX soon. What is your advice? Sir, you literally just missed all the advice that I just said. All right. You need to recreate your testing environment. You need to be doing questions. You need to be doing answers. You need to be reading the rationales. You need content. You need to put yourself on a schedule, time management. That's what I recommend. Now, if you need a review to study for NCLEX, I have a review. It's on demand. I actually have 2 NCLEX reviews in there. I have one where I break down the client needs sections, where y'all hear me say management of care is 15 to 21%, the largest section. I have questions and answers that I go over that are just on that section. And then I go down another one. Then I have a whole other section where I'm going over like 100 questions. Will you go after 2 weeks LPN exam? I don't know what that means. Oh, I will go after 2 weeks LPN exam. So you'll go where? I don't know what you mean. I don't know what you mean, user 61. So what else? I said I was going to leave and y'all held me hostage. Because of course, when I tell you I'm going to leave, exit stage left, like, here come all the questions. So, hey, if you guys are just now joining, my name is Kevin. I am a nurse. I specifically help with NCLEX. I have been a nurse for 4 years. I was in the Navy for 16. I've been a teacher for 9. I'm actually teaching TNCC, or the Trauma Nursing Core course. I'm teaching that this weekend. I've been a TNCC instructor for, oh my goodness, 4 years. So yeah, I enjoy the teaching. What other questions do you guys have? I will take NCLEX exam after 2 weeks. So you're going to take your NCLEX exam in 2 weeks. Got you. I'm tracking. What's up? Is it Ceci Lover or CC Lover? Ceci Love or Ceci Love. Obviously, I don't know how to read. Thank you for the follow. I appreciate you. Hey, if you guys are just now joining, welcome. You guys can ask a nurse. Ask me whatever you guys got, whatever questions you guys got. Hey, I know I'm not that Asian dude, because I know that dude, he gets on and he has like 10,000 people that's sitting there asking him stupid ass questions. Mostly it's just thirsty ass girls that are just like, oh my God, are you single? But, we all got our purpose. We all got our purpose. So what other questions do you guys have? And if you guys are just now joining, I want to know who you are, where you're from, where you're at in your nursing journey. It says, what does a new grad in the ICU start at in your area? Not enough, Jason, let me tell you. When I first started in the ICU as a new grad, I was making, it was like 25 an hour. And then like after 6 months, they bumped you up like $4 or $5. And then they didn't even give you specialty pay, which to me was wild. Like I think all critical care nurses should have specialty pay. So, but now it's a little bit higher. I want to say they start new grads off at like maybe 30 or 35. So I took my NCLEX PN today and it's stopped at 85. I'm so nervous. It's already sealed. 2024. It's already sealed. Don't be nervous. Well, put it this way. I would rather you be nervous now than when you were taking your exam. You probably were, right? But here's the thing. It's already done. You don't have control over this waiting period right now. However, we have control of our actions that's going to happen after the fact. But that's okay if you got 85 questions. That's okay. I normalize passing at 150. You know what I'm saying? And so that's okay. I know that you did well and you put in the work for it. So California, currently looking at the nursing pathway options. So in California, look, you need to go follow the lady. It's Night Nurse 305 TV, which is Nurse Larissa. That lady right there will be able to find a lot of, you need to go follow her. Like she is the one who finds nursing schools. That is her thing. Nursing schools that are credible. And go, hey, y'all in California, two-year nursing programs that are $180,000 is highway robbery. But nursing schools in California are extremely competitive. You live in Arkansas. Shout out to you, sir. It says the bearded black nurse. Shout out to you, sir. Arkansas. So you live in Texarkana? LPN for about a year and a half, taking my RN boards in June. Shout out to you, Alyssa. Do you think that it would be a bad idea to start off in a trauma ICU? No, I started off in an ICU. I started off working in a burn ICU, and I did that for 6 months, and then I moved to a medical and neuro ICU, or medical, and I floated to neuro for like another 7 or 8 months, and then I left the ICU after that. Good night from Kenya. Good night to you, sir. Is it Cheyenne? I take my NCLEX at the end of May. Do I need to spend money on Archer or UWorld? My program use ATI. I feel like I'm ready, but I'm nervous. If you're ready, you're ready. You don't need to buy nothing. You're ready. You're ready. Hi, a student from the Philippines. Shout out to you. I love the Philippines. All right. I have some of the best Filipino nurses ever. And I used to say, she was just like, Kevin, I'm Filipino. And I'm just like, shit. I probably shouldn't say it like that. But it's funny because they were great. They were wonderful to me. And there was a lot of the older nurses that were wonderful to me. So, yes, it's insane in Cali. Very discouraging. What's her name again? Night Nurse 305 TV. And it's Nurse Larissa. She'll probably be going live later on today, and you'll probably see me in there moderating her chat, because that's what I do. Little Rock and Dallas. So you travel in between both. I'm from Texas, but I'm currently in Arkansas. Okay, cool. Shout out to you, sir. Shout out to you. Happy Nurses Week to you, my guy. Happy Nurses Week. All right. In Florence, we trust. Kind of not, sort of, maybe not really. But what other question do you guys have? Shout out to all 60 of y'all. Hey, we're just answering questions. We're just vibing right now on this Wednesday. Answering questions for whatever you guys got going on. Hey, make sure you guys go over there and follow Nurse Larissa, which is the Night Nurse 305 TV. That is the lady who will get you hooked up for nursing schools if you're trying to get into nursing school, as well as how to make money using that nurse money. It says note-taking tips for pediatrics just started. So you need to understand that you have two patients. You need to understand that you have two patients. You need to know everything that's going on with mom. You need to know everything that's going on with baby, right? One of the biggest things when it comes to mom and baby, when in doubt, check the fetal heart rate. That's a big, big thing. All right. But you need to go ahead and make 2 separate columns about moms. All right. And understand that there are other disease processes that come, such as eclampsia, preeclampsia, abrupto placentae, right? All those big ones. Those are big things. The most common things that you see that'll be on your exams are seen out there in the real world. Okay. Oh, we're talking about, you said peds, not OB. I'm sorry. Now with peds, realize that a lot of their stuff is higher. Everything peds is high. High respiratory rate, high heart rate, high respiratory rate, heart rate, pulse, all that stuff. All right. And babies decompensate faster. Okay. They decompensate faster. All right. Know your congenital heart defects, stuff like that. So if you're using HESI, I would recommend using the Saunders book and Elsevier. If you're using ATI, use the ATI books that they give you, because that's how they create their test. It's based off of those books. All right. NCLEX is different because they pull from a whole bunch of books and they find a median and then they make their questions. Okay. Kaya says, professor only gave out page numbers, no lecture. Yeah, I see that. I'm trying to think of somebody who has really good pediatric lectures. I can't really think of it right off the top of my head. That's how it was when I was in school too. They were just like, hey, you're a self-learner, go figure it out. Best way to prepare for the med-surg HESI, 2 things, Elsevier and Saunders book. That's one thing. Elsevier and Saunders book. Second thing is get into a study group. And this is what I had to learn. I learned it after fundamentals. I was in fundamentals, health assessment, and communications. And then after that, I was like, I need to be in a group with people so we can study together. It helps alleviate a lot of the work and a lot of the headache. So I got into a group with 3 other women, right? And then we split all the work up, right? Every single time we split the work up, all right? We reaped 100% of the benefits, but we did a quarter of the work. All right. So do that. And if you get into a group and a motherfucker ain't pulling their weight, kick that ass out and bring in somebody else who's going to pull their weight. That's how you do that. All right. Oh, I missed our day. Oh my God. Say it isn't so. Say it isn't so. Ma'am, I missed you so much. I didn't at all. What's the best online study site tools to study for NCLEX? The 7-day NCLEX course, which is my course. It's linked in my bio. Go check it out in my link tree. Right now it's going 70% off. It's $97. My guy, I appreciate the puffs and I appreciate the roses. I'm just now seeing this. Do you have eczema? Of course I got eczema. What are we talking about right now? You're welcome. Is it Kaya? You're welcome. Is it Chatty? Yes. So yes, you are welcome. You are welcome. Shout out to all 49 of y'all out here rocking. We're doing NCLEX questions. We're not doing NCLEX questions because that's what I just got finished doing not too long ago. See, I'm in a rhythm. My name is Kevin. I've been a nurse for almost 4 years. June 5th will be 4 years. I worked ICU, OR, and PACU. What questions do you guys have about NCLEX, about nursing, about any of the sort? All right. Thanks for your insight. You're welcome, sir. No problem. Hey, that's another thing, that not all nurses are built the same. Not all nurses are built the same, and not everybody's experience is the same. All right. So as you guys start to grow up into your nursing journey, just realize that and understand that. All right. A lot of people try to throw that weight around saying like, hey, oh, I worked critical care. I did this. Okay, cool. I worked in a clinic and I loved it. Look, your opinion of what I do don't got shit to do with me. Period. So just saying. Sarah says, what's your favorite specialty? Man, I liked all aspects of them. Like I loved the ICU because of the autonomy that I had and all of the knowledge and training that you have to take care of a patient. I love the PACUs because they were in and then they were out, right? But it was a lot of, it's not like critical care, but it's like a little step down from that because you really got to take care of these patients when they're coming out of the operating room because of their airway issues, right? And so, hey, once they're taken care of, they're going right back up to the floor. So you don't get to keep them long, right? And now when I worked as an OR nurse or a circulator, it's all about like you have timestamps. That's the biggest thing is because time is money. If you have 5 patients, you got to work at a steady pace, getting these patients in and out and taking care of everything that's going around in the room. The surgeons, anesthesia, the surge techs, the reps that are coming in, like you got to really be moving. So honestly, when it came to me where I'm just like, bro, I'm tired. I loved the PACU. I loved it. And you hear people say PACU is not really nursing. Hey, no part of me gives a shit about what you think. That's okay though. Go out there, hey, and enjoy what you do. LPN and an RN BSN program. Shout out to you, sir. Shout out to you. Hey man, you'll have that BSN. You have that BSN. You'll have that RN license before you know it, man. You'll blink and it'll be here. Graduate in a couple months? Exactly my point. Hey, so what other questions do you guys have? What other questions do you guys have? Period, boo. Hey, if you guys are just now joining, hey, I do NCLEX questions every Monday, Wednesday, Friday, 5:30. I failed my first A&P exam. Any tips? Khan Academy on YouTube. Khan Academy on YouTube. KHAN Academy on YouTube. A&P was fantastic, and that's exactly what I did. It did someone or something inspire your decision on becoming a nurse? I had a lot of good, when I was in the Navy, I had a lot of good inspirational people around me. At first, I wanted to go be a doctor. And then I was just like, no. A lot of times doctors forget that people are people, and nurses are all about patient. Nursing is patient driven, while doctors are medicine driven, with the patients being a part of that, but it's medicine driven, right? But in nursing, it's patient driven. And then I told a buddy of mine, I was like, I want to be a nurse because I want more responsibility, but I really do find the passion in taking care of my fellow brothers and sisters in arms, right? Because if y'all didn't know, I was right here. I was in the Navy for quite some time, a decade and a half and some change, right? And then the moment I said that, they deployed me. They were just like, hey, you want to go to Afghanistan? And I'm just like, yeah. And they're like, good, because you're on the first thing smoking. And that's what happened in 2012. So that's when my nursing journey began. I opened my mouth and said I want to be a nurse, and then boom, I was on my way to a deployment a few months later. So, and then when I was deployed, I really got to see what wartime medicine looked like. And that's how when I said what I said months prior, and then when I was there and I realized what I was doing, it solidified in my brain that nursing was where I wanted to go. But I didn't realize that the journey of becoming a nurse was going to be a very long one. And it was, because I said I wanted to be a nurse in 2012 and I didn't become a nurse until 2020. If you go talk to Nurse Amber, it took her 17 years for her to get here. She was delayed, never denied. Same with me. Saying that's the same for each and every one of y'all. So, when I came back from Afghanistan a year later, I started doing my prereqs and I started knocking them out. I lived in Florida at the time, and then I moved back to Texas. And I was an instructor at a surge tech program. I did that for about 3.5 years. I started nursing school when I was teaching. And then I was applying for officer programs and I didn't get picked. So I still went to school anyway. And it was tough. It was very tough. Is it doable? 100%. A lot of people are just like, hey, can you work while you go to nursing school? Yes, you can. But it's hard. It's very, very hard. And then I transferred to another place, which was another instructor duty. And I taught for another 3.5 years while I was on active duty. So I was a total of 7. I took my NCLEX 3 times. How many times did you take your NCLEX? I took it 3 times. And I failed it. First time was at 75 questions. Second time was 265 questions. Third time was at 105 questions. And then I took it during COVID. It was June of 2020, June 5th, 2020. And that's when I took it and I finally had got my license. So, that's, in a nutshell, that's kind of how it happened. There's a lot of things that happened in between there, which is why I wrote Conquer It, because I want y'all to know and understand that the journey may be different, but the destination is the same, acquiring that license. All right. It says 30 when I became an RN, 40 to 45 when I got my BSN and nurse practitioner and worked 36 hours a week. Shout out to you, Tim. Hey, listen, the moment that they said I could work 3 days a week, you got no more, you got no less. Everybody was like, hey, you want to do overtime? No, I do not. So no. What did you do to keep motivated? I kept people around. I kept people around me that motivated me. I got a mentor. A mentor was number one. That was by far the number one thing. But then I realized what my goal was. My goal was to come out here and change lives in some way, shape, or form. Remember, like most people that are in the military that become very patriotic, a very hard thing that happens when you get out of the military is you lose your sense of service, meaning the service of the brother and sisterhood that you have with other people to do things for each other. When you get out of the service, you lose that because civilians are selfish, and I noticed that. And so in order for me to find some sense of self for myself, is I had to create a community for myself to be able to continue to give back, essentially like my second service, if that makes sense. All right. And my second service is to turn around and teach, use the skills that I have and the skills that I've acquired over the 16 years of my service and my 4 years of being a nurse of giving it back to somebody else. And why would I not do that? I've literally worked with nurses when I'd ask them a question and they were just like, they would ask me, they would answer it in such a rude way. And I'm just like, do you talk to everybody like that? And I was just like, I would really hate for you to say that to the wrong person. You know what I'm saying? So I realized that this is what I wanted to do. And I wanted to teach and I wanted to continue teaching. And I also want to continue to be a student. And that's exactly what I am. So I learn everything. I learn all the time from y'all. So that's exactly what happened. That's what keeps me motivated to come out here every other day, to create a course, to do coaching, to participate with other people and give y'all this knowledge. This is what we do. I graduated in December with my ASN RN. I'm not feeling confident. Any advice? Is it Drea? Ma'am, you got time. You got plenty of time. What are you not confident about? Maggie says, I passed my NCLEX. Thanks to watching your lives. Maggie, ma'am, congratulations to you. Maggie, I don't know if you're still here, but congratulations to you. Everybody, I need for all 48 of y'all to give Maggie love right now. Welcome to the greatest shit show on earth, Maggie, known as being a nurse. Whether you're an RN or LPN, happy Nurses Week, by the way, to you now, Maggie. If there's a piece of advice that you can give to anybody, what would it be about your nursing journey, especially about NCLEX and how to overcome that? What would it be? And once again, ma'am, congratulations to you. I've been learning from 2019 ATI, and they updated it in 2023. So, Jack, don't think about the updates are just how the course is delivered to you. It's not necessarily the curriculum. Curriculum changes very, very minutely, so much to where you can't understand. You won't even notice it. That's awesome. Hey, Maritza, that's what I do. That's what I do. That is what I do. Naja, good evening to you. Naja, good evening to you. Hey, so what other questions? Y'all held me hostage. I said I was leaving like half hour ago. Now y'all got all these questions y'all want to ask me. You know what I'm saying? So what are we thinking? What other question? I'm going to hang out for like another 4 minutes because I really do got some other stuff that I got to do for my live that I'm doing for my community tomorrow. By the way, I created a community. It's not available to you guys yet, but that community is going to be $10. It's going to be $10 where I do live and click. Y'all think y'all like these questions? I have a whole bunch of other questions inside of this other live that I do where they're pre-recorded and we go through stuff. That's a really good place to get a hold of me because I'm active in there all the time. So that's going to be available to y'all come soon. So you make sure you guys look out for that. What question bank did you use for NCLEX? I used Hearst. Let's start off. I used Saunders. I used Board Vitals. I used Hearst. I used UWorld like 3 times. I used Mark Klimick. He didn't really have questions then. I used Kaplan. I've used Lippincott. I used a lot, but what helped me pass was Kaplan. But once again, if you're not in the mindset, realize these tools are out here because they work. These tools are out here because they work. These tools are out here because they work. Now, do they work for you? Probably not. Now, if I gave you, we'll pretend this is a screwdriver. I said, hey, go put that nail in the wall. You're going to look at me and be like, this is not the right tool to use to do that. All right. That may not be the right tool for you. All right. UWorld is nothing like the NCLEX. See, Rose right here is saying that UWorld is nothing like the NCLEX versus if I go talk to my A1 since day one, she will tell you that she will take UWorld over everybody. You see what I'm saying? So it just depends. When I took the NCLEX in 2003, got 265 questions, got the whole test. Don't know if they have that many. So Tim, they updated the NCLEX test plan April 1st of 2023. And it now is 85 to 150 questions. So when I passed NCLEX, it was 75 to 265 questions. As somebody, I took it 3 times. I got 75, I got 265, and then I got 105. And another reason why they lowered the questions was because, it's still the ongoing issue with COVID. So now they lowered it from 75 to 265 to 85 to 150, right? They decreased it by an hour and everything. Happy Nurses Week to you. Who said that? Tretta, is that you? Of course it is. Of course it is. I'm looking at your profile pic. Of course it is. You don't know how to act. What did you use, Rose? Oh yeah, of course it's you. Salute. All right. All right, I got about another minute. What other question you guys have? Nicole, do you miss me or what? She's like, oh my God, come back. No, never, never, ever again. All right. Yo, what's the deal? You're lying. Tretta, you're lying so much. All right, y'all. All right, y'all. So I'm going to go ahead. I'm going to get off. I love being here with you guys. Took my NCLEX today. Stop at 140. Hey, Maria, I love to see it. 6 more months and you're out. Yes, that's what I'm talking about. Hey, let me know what's up. You got my number. Jack, you are welcome, my good sir. Hey, so like I said, I appreciate everybody stopping by. Nursing school, yes, you already know what's up. You book, how much is it? You mean my book, how much is it? My book, my ebook is, which book do you mean? Hold on. Because I have an ebook, it's $29. And then my published book, if you get it on Kindle, it's $14.97. And if you get it on paperback, it'll be $24.99. Hello, I failed my PX. What do you recommend? First thing I recommend is that you get your performance breakdown and you see what areas that you didn't do well on, and that's where you start. Elaine, you are welcome. Would you ever consider remote nursing? I will tell everybody to do remote nursing, Nessie, straight up. I'm serious. I'm not being sarcastic either. Your ebook. Oh, it's $29. Ebook is $29. You can find it if you tap my face up here, and then you see my big face right here, and then you go to my main page, go to the link tree. Everything is in there. Is nursing degree hard to get? Are you back here trolling me again, bro? Like, you're a doctor. You tell me if you think. You tell me if you think getting a nursing degree is hard. I have a huge neck tattoo. How can I go about it? I don't even know what that means. What is your neck? Like, you need to give me a little bit more context. Is a nursing degree hard to get? It is hard to get. It's the journey that makes it very hard. Just like going to medical school. It's just like going to it's not medical school. It's not medical school. Just saw a video. Said it's the 4th hardest degree. At one point, nursing was like one of the hardest. It was actually harder to get through nursing school than it was to get through medical school. So when did you take the NCLEX? I took it in 2018, twice in 2019, and then once in 2020, and that's when I got my license. So, but all right, y'all are food depriving me. Okay. All right. If y'all got any questions, hey, make sure you guys go check out what I got going on. Go comment on all the videos that I got. I posted a question, an NCLEX question today. Go interact with that. Go see all the stuff that I got going on. All right. Make sure you guys pay attention. Make sure you guys like, you guys share, you guys follow. I love y'all. I appreciate y'all being here. Make sure you guys and gals, take care of yourselves mentally, physically, spiritually, all right, and emotionally. Because if you can't take care of you, you are no good to no one. All right. So always take care of you, because if you are good, you can take care of you and everyone else. All right. So until then, ladies and gentlemen, I will see everybody. Ooh, I may not be able to see y'all on Friday. Maybe on Friday. We'll talk about it. But I'll see y'all. Bye.